Want to ensure as many people as possible have access to preventative care and a medical home.
Rural hospitals say their health care services are at risk if they can't get adequate state and federal funding. Good evening, everyone. I'm David Andrews.
And I'm Ann Emmerich. In the fallout of major federal funding changes for health care, patients and providers say they are relying on funding from the state of Michigan to help them keep afloat. News 10's Riley Connell joins us now in studio with more.
Yeah, Ann and David, healthcare experts have been sounding the alarm about the challenges brought on by federal funding cuts since late last year, warning that rural hospitals could face closures as a result. Now, as the Michigan legislature negotiates the next fiscal year's budget, hospital leaders tell me they are watching those decisions closely.
Maybe there is ways to improve the system, but there are so many people that are 100% depending on Medicaid.
Grand Rapids resident Elfie Listow says she came to Lansing to share her concerns with state lawmakers on Wednesday after her grandson was hit with a $3,300 hospital bill he cannot afford.
That is paying $300 a month insurance premium, which is very hard for him to do.
Some Michigan hospitals share Listow's worries. Kirsten Newland says threats to Medicaid funding at both the state and federal levels puts Hillsdale Hospital at risk.
And if a rural community doesn't have its hospital, then it really loses its heart. It loses its economic engine.
Federal health care cuts could surpass $1 trillion over the next decade. If Michigan also makes cuts, Newland says critical services could be on the chopping block.
It will start with centers like birthing centers, behavioral health centers, home care services, things like that are more community benefit that really rely on Medicaid.
Ben Frederick says Memorial Healthcare in Owasso is also bracing for the impact of potential cuts.
Most rural hospitals operate on pretty thin margins. So it's definitely something that we have a tremendous focus on with Memorial.
With state budget negotiations underway, Memorial Healthcare is reaching out to nonprofit partners and at-risk patients.
And we just want to make sure that we're coming together as a community and identifying and making sure that these individuals remain connected to their care.
And a recent study by the Center for Healthcare Quality and Payment Reform suggests as many as 9 rural Michigan hospitals could be at risk of closing in the near future. Both Hillsdale Hospital and Memorial Healthcare officials tell me they remain in a strong financial position for now. Back to you, Ann.
Thank you. Healthcare experts from around the state recently testified before state lawmakers to stress the importance of Medicaid funding. They're hoping the legislature makes it a priority.